And so we're gonna give you the behind the scenes look. Okay, it's Stages of Life's weekly show, a weekly guide to a healthier you with Dr. David Klein. Okay, and it's live call in, so I don't know who's going to call me. Don't even care. We'll get some texts and they'll read them in between just to make sure that we have enough interesting stuff going on. And we usually lead things off with a 5 or 10 minute ramble, rant, rave, depending on how you want to look at it. And today, what I'm going to do is I'm going to talk about a major event that we just had called the coronavirus. We all remember this. It's still, even though you might have the memory of a gnat, okay, it's still going on. So you woke up to it. It's still here. And what's it all about? What lessons could we have learned? I'm not going to get into the ones that have already done on Facebook. Okay, Stages of Life Medical Institute. If you like it, you're going to see about 40 different videos that we did. They're all, not all of them are good. I'd say most of them are good. But in any event, Melissa here did them with me, so I know they're actually all very good. But this one's going to be a little bit different, and I'll do it on the Facebook tomorrow. And it's what did we learn medically from this? And it's not a matter of, well, gee, we needed more face masks. Okay, that's an obvious one. We could have used more ventilators, maybe so. But what could we have done, and what should we be doing now to make ourselves healthier so that we don't end up as roadkill on the next one? So this is the first of a series of these sorts of epidemics and pandemics, and we do get them every 6 to 10 years, 12 years. That's just the way it goes. You forgot the last one because you slept through it. But every year we lose 50,000 Americans to flu, influenza. Not always old people. It can be young people. 1917, we lost just 100 times more than it altogether. I mean, it was one of those sorts of deals where it caught us sleeping. Not that there was anything they could do about it. 1917, 1918, you got the flu, you got pneumonia, you were dead. End of discussion. Now we can keep you alive long enough to harvest your kidneys. So what are we going to do? What I'm going to talk about is the sorts of things that you need to be considering to get your health in good condition. And it doesn't mean go out and buy expensive medication so you can look better in a bikini. If you have autoimmune disorders, you don't want to be going out there and compromising your immune system. If you're overweight, you need to bring it down and get the diabetes under control, or the pre-diabetes, the hypertension. The sorts of things that are going to come out of this are going to be, what can you do to reduce your risk the next time, which I believe is going to be in September in this area. September, October, November, we're going to see corona come back. Now, my office is uniquely postured to actually test for it. So we can do those tests that you're standing online at the Orange County Convention Center. We do them in my office. We can run the PCR up in our Jacksonville office if we choose to. It might be cheaper for you to wait 2 weeks. So we typically, figure out what the least expensive route is. If you want to pay for it, we'll do it. We do the point of care testing, which is very, very inexpensive. It tells you whether you have antibodies to it, whether you're at risk to get it again. Now, that's not necessarily all that available right now. We're amongst the first in the country that's able to do it, has the facility to do it. So what can you do and what should you do? And the better question I'm thinking to myself is, what should I do to make myself more available to other people? And that right now is a problem for me because I don't really know how to replicate myself. Okay, I can't clone myself. It's been tried. It didn't work. So what are we going to do? Okay, we're going to talk about the major wake-up call. What's it going to be? So do you have pre-diabetes? Okay, it's real easy to figure out. We can look at your weight and height, and I can tell you very, very quickly by looking at your basal, or your BMI, basal medical, or the index, obesity index. If it's over 30, odds are that you have an elevated insulin. For $15, we can check your insulin level and see whether it's elevated. If it is, you have pre-diabetes. So what do we do? We start fixing our nutrition. Some of it's easy, much of it's hard. It's all habit driven. So that is what we're going to do, unless you have additional questions. Okay, and you can actually call in. It's kind of interesting. It's at WDBO, Radio 96.5 FM, and if you hold on just a second, you're going to get all the radio, television, and telephone contact information you could ever want.
Because the doctor is one
Let's
of the top
hear what we've
authorities
got
on
going
this.
in the background.
We were covering this corona mess way
go.
back months and months ago before anybody was talking about it at all. So Dr. David Klein is from the Stages of Life Medical Institute. Go to stagesoflifemedicalinstitute.com. That will open you up to a myriad of websites that will answer almost every question you've ever had about health. Matter of fact, I kind of forgot the other day what one of my medicines was for. So I go on there, boom, there it was. I also asked Alexa, and she knew too. All right, so if you want to join the show, 844-220-0965, 844-220-0965. You can text us at 21232, 21232. Ken is already on the line, but let's open it up with Dr. David Klein in your opening monologue.
Well, what I want to chat about today is something very, very simple. And it's
Dr. Klein, are you there?
I am here, Robert. Let's see what I love live radio. Are you there, Robert?
Yeah. Hi, Dr. Klein. What's going on?
I'm not sure what the problem is there, but that's the difficulty not being in the studio there with you. So today I wanted to discuss, is what are the medical vulnerabilities that became clear with this COVID crisis? What have we discovered about ourselves that really is most compelling? What do we have to fix? What is the big, big lesson to be learned here? And it's not, we could have a shortage of masks. I don't think you're ever going to see that happen again, because masks are cheap. You can buy a box of 100 for about $9, So when all this is over, they're going to be cheap again. Gallons are going to be very, very cheap. They're going to be sitting in our national stockpile. The hospitals are going to be mandated to have lots of them there. Locally here in Orlando, the hospitals don't even have shoe covers. They're having to issue nurses masks that are supposed to last a week or more. And these are the paper ones that aren't supposed to last 1 hour. So we still have a problem, whether the feds have issues or they don't. They're all in New York, because after all, that's really the only place there's a problem right now is in New York, of course. So what has this taught us about our vulnerabilities? And the first lesson we have to learn here isn't to go stock up on toilet paper. The first lesson is you have to get your health under better control. So the people that are dropping, the people that are roadkill in this particular pandemic, the roadkill are people that have chronic illnesses, recognized or unrecognized. It doesn't matter if you know that you have hypertension or you don't. What are the symptoms of hypertension? Usually nothing. Whether you have diabetes or you don't. What are the symptoms? You might not know it. A lot of people go 10 or 15 years before they ever discover they have diabetes, and yet you're equally vulnerable, or more so. What else can we look at that causes these issues? If you have any of the many diseases that are treated by the ones you see on television, if you want to look better in a bathing suit, get this $14,000 a month medication, even though it could cause you to have a reoccurrence of your tuberculosis or hepatitis. Things that alter your immune system. So what do we want to do? The very first thing we want to do is to sit back and identify those individuals that have these chronic illnesses and understand that hypertension is very easily treatable. And it's even more interesting. You can deal and you can treat with the underlying disease states that cause hypertension because, wouldn't you know it, COVID attacks one of the receptors called ACE2, which is necessary you look for this thing to treat hypertension. That is the access point that COVID has to get into the cell, ACE2. Wouldn't you know it? It's throughout the respiratory tract, but even greater amounts in the gastrointestinal tract. So we need to look at ourselves critically. So where is the problem? What's the real issue with the obesity crisis and all this other stuff going on? And the answer is clear, and it can be found looking back at you in the mirror. You are the problem. You are the issue. So parents, you need to teach your children better. You need to be a better example to them. You need to do something about the cigarette smoking. Why? Because it does, in fact, compromise your immune system. Just look at the fact that it increases your chance of all cancers. You got to get your weight under control. Eat better. Teach your kids how to cook. Teach your kids that, no, dinner isn't going through the drive-through line at McDonald's. That is not what it's all about. Because ignorance is what this is all about, is likely to result in impairment, death, and disability. This is no joke. Well, what about the young people that died with COVID? Yeah, who knows what was wrong with them, the underlying illnesses? You don't really know now, do you? All you know is that somebody without age on them died. But we also know that many more people that were elderly, where we had very good medical records, it was fairly easy to sort that out. So what else? Bad behavior. Couch surfing, bad idea. Stress eating, fast food dependence, lack of understanding on what basic nutrition is all about. So you're going to think, well, gee, when I was in elementary school or middle school, they taught us about nutrition and the food pyramid. And I'd say, well, that's very interesting. But you were probably taught that nobody knows how aspirin works. Well, you know something? That was figured out 35 or 40 years ago, which might have been 10 or 15 years after you were in middle school. So understand, okay, that there are treatments, there are cures, there are preventions for these illnesses. So if you wanted to give somebody, this is one of my favorites, if you wanted to give somebody an aortic aneurysm, you take copper out of their diet. Take copper out of a person's diet, and they increase the risk of developing aneurysm, vascular abnormality. Why? Because copper is necessary for cross-linking within the collagen that's in the arteries. So how do you prevent it? Wouldn't you know it? By taking adequate amounts of copper. Not too much, by the way, just enough. Zinc will prevent a lot of thyroid disease. Chromium and vanadium will prevent diabetes if given in the appropriate amounts, ratios, and the right form. And this is where I'm knocking myself out, trying to figure out how can I make a dent in this personally. Why would one guy be able to? I don't know. It's Don Quixote. Okay, you're working yourself after a windmill, but it doesn't mean I'm not going to try. Okay, but how do you convince people that you can actually fix these problems? So the metaphor that I'm going to use here, and then I'm going to turn the phones over to you, Robert, is that your body, okay, is like having a very, very fine house. It can look good from the road, okay? It's going to have marvelous curb appeal, but it can be torn apart by termites, in which case it's not going to be habitable very long. It can have a marvelous appearance to it, and the roof may have a hole in it or some kind of an abnormality or damage to it, and you can develop black mold, and you lose the whole house. It's the same thing if you have a lousy piece of wood and you put fine paint on it. It doesn't do anything but make it look better temporarily. So you can look at somebody and think, man, that person looks marvelous, but what's underneath the canvas may really surprise you. So my goal in this, why do I care about this? The goal is going to be education. Okay, and it's not an easy education. I want you to go out and buy Super Beets. I mean, what kind of craziness is that? Okay, if something doesn't taste good, it's probably not good for you. I got to promise you that. Okay, I've never tasted a beet that really tasted good. Okay, when things taste good, usually it means that the body is looking for it. So what is the goal that we've got here is to teach people what they have to do to maintain, regain, and to make their kids healthier. I mean, what better legacy than to leave a legacy of health to your children? It doesn't make any sense not to, and that's where we are with it. So today, that's kind of what I'd like to talk about. So, Robert, the phone is yours.
Well, thank you, my friend, and it's good to be on the air with you. 844-220-0965, 844-220-0965. Call us right now. You don't have to use your real name. This is a medical show, So anyway, give us a call, 844-220-0965. I would suggest that you put that into your contacts, okay? And if you want to text the doctor, it's 21232, 21232. Let's go to Ken right here in Orlando. He's been holding since the show started. Ken, what is your question and your conversation with Dr. Klein?
It's great information, Doctor. Thank you so much. I have two questions.
Sure.
One is, I believe I have gallstones.
All right. Well, tell me about
I got like a stomach ache, pain in the right-hand side.
Okay.
And it gets worse when I lay down, though, or eat ice. Does that make sense?
When you eat ice?
Yeah, when I eat ice or drink something cold or when I lay down at night.
Okay. All right. Generally speaking with gallstones, okay, you're going to feel a little bit better if you lie down, but principally you'll feel better if you lie on your left side. So you'll end up with gallbladder symptoms, and you roll to your left side, things tend to fix or start feeling better very, very quickly. But ice won't trigger it. Fatty foods, oily foods will. But there are things that you can do that will give you this type of picture, and one of which is just simple reflux esophagitis. So you're going to lie down. The stomach acid is now percolating upwards towards something called the lower esophageal sphincter, okay, the LES, heretofore to be called, and it tends to irritate that area and go into spasm. It causes what used to be referred to as heartburn. But why would cold things do it? Why would ice do it? And the answer is because any chemical, physical irritant against a raw area of mucosa is going to cause it to go into spasm. So I would be willing to bet you that you'd have the same type of symptoms if you sipped on a fine cognac, something along those lines, because it's going to go down there, hit that area, and send it into spasm. Or it could be very spicy food if you're so sensitive to it. But cold, it makes a lot of sense. The esophagus will go into spasm, but that does not sound like gallstones. Now, the way that you can detect gallstones, very, very easy thing to do, is to get an ultrasound. And we do them actually in the office at stages. And the reason we do them there is because gallbladder disease is very, very common. And I don't like to wait. Okay, I'm an impatient person by nature. So if I want something done, I walk over to my ultrasound tech, and then I convince her that it would be well within her, it'd be a good idea if she went ahead and did the test. So we will find gallstones in folks, and we'll find sludge in the gallbladder, almost equally with equal frequency. So sludge can give you the same kind of a picture. But what do I think is going on with you? I think you have reflux esophagitis. Were I you, okay, I would be taking something called sucralfate. Brand name used to be Carafate. And these are 1 gram tablets, and they're very inexpensive. And you take one of those puppies, stick it in your mouth, hold it for about 30 seconds. Okay? And it tastes a little chalky. It's not so bad, but it softens the tablet. Then you go to swallow it. And it's like an eraser working its way down your esophagus, all the way down, and then it covers that area that's raw within the esophagus, and if I'm right, it'll settle it down in about 30 seconds. It's a great test.
Wow.
Okay, what does it cost? About $15 for 60 of them if you go to Publix. Very, very inexpensive stuff. But that
Could you spell that, please? I'm sorry.
Sucralfate. Sucralfate. Ralfate. And your doctor writes a prescription for it. Sucralfate. Or if you'd prefer, Carafate. It's a little easier. Carafate used to be the brand name of the stuff.
Carfate, okay.
Carafate, yeah. And your doctor's probably familiar with it. And it's marvelous stuff. It has essentially no side effects. So when you have heartburn, you lie down, it gets worse. You wake up in the morning with a cough. You think it might be postnasal drip. You think it might be allergies. It could also be reflux esophagitis. So I use Carafate in my practice a lot, okay, because it is one of those sorts of things that's like, oh, I don't know, it would be duct tape to a redneck, okay? You with me? You want to get somebody from Bithell a little upset. Takeaway is duct tape, all right? So but that's what the stuff is. To my practice, this stuff is absolutely, it's gold. Because it gives you lots and lots of bang for your buck, very, very few side effect issues. Almost, I don't know if I've ever had anybody that couldn't take it. The hard part with it is finding a family doc that even knows about it because it's too inexpensive. What we do is,
wow.
as part of the Hippocratic Oath, my professor of medicine when I was in school said, that they ought to amend the Hippocratic Oath for a line that says, "And I promise to prescribe medications as long as they're brand name and expensive." So no, happily that never happened. So Ken, give that a try, and then let us know how it goes.
Thank you very much for the
how
call,
about the other
Ken.
thing?
And
Where I
if
have
you
to...
want to take,
what you got, Ken?
If you want to take Ken's line, just.
Oh, I think we lost him.
Can I answer the other question?
Oh, well, you can ask the question. I'll try to answer it for you. So what's up,
Okay,
my friend?
I have to get up a lot of times to go to the bathroom at night, but I don't have to do it during the day.
Okay. All right. Ken, how old are you?
62.
All right. Well, what happens as men get older is their prostate gets larger. Okay. Estrogen levels climb in men as they drop off to zero in women. And then the prostate will enlarge as a result of the increase in estrogen. So you can have a little bit of irritation of the prostate, and that can make you want to go to the bathroom. The other possibility, this is more interesting, is that you may be consuming too much salt in your food. This will cause fluid retention, and then when you go to lie down, your legs are elevated, and your body tries to mobilize the fluid. So look at your legs and see if they're swelling at all. If they're swelling a little bit, or if you have what they call pitting edema of your, below your knees and whatnot, then it may be just a simple matter that you're either drinking too late at night. It's a possibility. I do that. Or there's too much salt in your diet. But prostate and salt retention would be my two most likely possibilities to give you that picture. So let's give that a whack, Ken, and see how you do with it.
Okay, and Ken, feel really free to call back on the show anytime in the future, 844-220-0965, 844-220-0965, or you could text us at 21232, 21232. That goes for everybody out there listening in as we talk to Dr. Klein today on the stages of life as we ask the experts. And we'll take a couple of minutes right now for the three big things you need to know right here on News 96.5 WDBO.
Oh, okay, and so while we're here, okay, so the next question that's going to come up, okay, well, just to give you a little heads up on this, somebody is asking about what conditions can make you more susceptible to COVID. All right, so I'm going to go over some of the things that you can control. I'm going to go over some of the things that you really can't control. And then I'm going to go over some of the realistic expectations for this, because a lot of folks are scared. I mean, and it's kind of hard not to be empathetic with this. Why would you be scared? The answer is simple. You have people on the television that would scare the crud out of anybody, but they're there for a reason, and it's self-serving. It's actually to make themselves a little bit more money, make themselves indispensable at their networks, to try to advance their careers and whatnot. And how do you best do that? Find yourself a crisis. Look for a parade. See where there's a parade starting, and then run to the front of it and grab the first flag and make it look like you started the parade. And that's what they're doing right now. And so you're going to hear all kinds of nonsense. All you really need to do to sort this out is to go back through newspapers, or actually to look at some of the timelines on these things. So you're hearing people, the reporters and whatnot, that are just absolutely misleading you. They're scaring the hell out of you. If you're hearing this discussion, odds are you're not in New York. Why? Because that's generally the way these things work. If I were living in New York, I'd be a little afraid right now. Why? Because you can't get from your apartment, which might be on the 14th or 18th or 35th floor of a building, without going down an elevator. And you're not going to come in contact with fewer than 60 to 80, 100 people. You know something? It's a little wonder they have a high incidence of COVID in New York City. New Jersey, why? Because it's every bit as bad as New York. But when you move yourself out let's just say to Western Pennsylvania, you're not likely to see the same population density. People are a little more sensible. They have backyards. It's just the way these things work. You don't have to drive on a subway to go to work every day, where you're going to, again, come in contact with thousands of people. And all it takes is one person to get sick. When the COVID epidemic hit, they were talking about one person being able to infect 5 or 8 people. Do you remember that? One person will go to 5 or 8, therefore. Why? Because in Wuhan province or Wuhan city, that population density would have allowed for this, as would New York City. But around here, United States, it's 1-to-1, 0.9. 1-to-1 transmission, maybe even less than that. If you took away New York City and New Jersey, if you took away New Orleans, where people were standing on top of each other for Mardi Gras, you'd find that a lot of husbands that have COVID don't give it to their wives. Okay, what's that all about? And vice versa. They don't seem to go between spouses very frequently. These are the most intimate of all contacts, and yet you don't see COVID necessarily being transmitted. How do I know this? Because I test people. You test positive, we'll test your wife, and she tests negative? Now, you're not separated, are you? Do you sleep in the same bed? Yeah. Do you use the same bathroom? Yeah. Do you use the same towels? Yeah. So contact tracing is going to be kind of interesting, but what is it going to take to actually end up making somebody else ill? So we're going to talk about medical conditions, health conditions that make you more susceptible in just a moment or so. So let me listen in to see what's happening.
You have a question.
Oh, I have a question. Oh, what have I got there?
Dr. Klein, you told me to take CLA and flaxseed oil for diverticulosis.
Yes, that is correct. And so CLA, conjugated linoleic acid, the dosage there is, I use 1,250 milligram capsules, and I take 2 of them twice a day. And the flaxseed are 1 gram capsules, and you take 2 at bedtime. What that does, okay, is it lubricates the colon. It's more of the oils than your body can absorb, so they work their way down and out. So by lubricating the portions of the diverticula, okay, these are little pockets that become infected or inflamed, causing diverticulitis. When the inflammation tends to go away and they're lubricated, they will collapse. They will go back to normal. And so you stay on this stuff. Your colon will start feeling pretty darn good, and you're never going to want to come off of it. Are you addicted to it? No. But you know what it feels like when it's bad, And when it's feeling pretty good, you forget all about it. So the first time you do without it for a week when you go on vacation, you're going to remember what your rear end's for. Medication is very good. Here we go.
All right, Dr. David Klein of the Stages of Life Institute in nearby Longwood is taking your calls right now. The Stages of Life Institute is open, regular hours, and of course they are taking patients. But you need to call Iris first, so give them a call, okay? 407-679-3337. That's 407-679-3337. And Dr. Klein is taking your calls right now on the air. So let's go to Ken, or is it Fred? Let's go to Fred right now. Fred, you're on the air.
Good afternoon. How are you, Dr. Klein?
Not bad, Fred. What you no good today?
I'm curious about a couple of the conditions that increase susceptibility to the coronavirus.
Sure.
And the question about those things is, do they make you more susceptible or do they make it more deadly? And the two things are obesity and diabetes. And also, is there a test to show whether your immune system is strong or healthy or not?
Okay, that's a couple good questions dug into that knot that you threw at me. Number one, okay, obesity increases your risk for lots and lots of disease states. Okay, not just coronavirus, but just about everything else, to include diabetes. It'll do it for, so obesity leads to diabetes, it leads to hypertension, it leads to cancer, and a bunch of things. So, what is it about obesity that would lead to increased risk with coronavirus? And it has to do with insulin resistance syndrome. So your insulin level will go up. Now, what does that do? You're going to say, well, it doesn't really make the virus grow now, does it? It doesn't. But insulin is pro-inflammatory. Okay, and what does that mean? It means that other sorts of inflammatory conditions are going to get worse. So you have COVID, and what kills with COVID is this cytokine cascade, and it goes in and you get infected and you do okay, and either you fight it off or you don't. But when you end up with this overwhelming inflammatory response, that's generally where your kidney shut down, lung shuts down, your heart stops working, and pretty soon you're gonna expire. Things don't go so well for you. So insulin resistance, elevations in insulin level, really is what leads to this. Not the sugar itself, but the insulin. Well, what else will do it? Hypertension, whether it's treated or untreated. Why is this? It has to do with some peculiarity of the ACE2 receptor. The ACE2 receptor is necessary for modulation and control of the blood pressure. Just the way these things work. It's where a good significant number of our blood pressure medications operate. What else will do it? When you have issues of disimmunity, okay, autoimmune disorders are a really good example of that. So your body is not operating properly. Well, what can cause things like scleroderma? What can cause lupus? What can cause rheumatoid arthritis? And it's usually a micronutrient deficiency and or a hormone imbalance state. These are the things that precede it. So people just don't wake up one day with rheumatoid. No. There are things that lead up to it. So what can you do? Okay, you want to get these things under control. And does it make you more likely to die from it? And the answer is yes. So we're going to talk more about this, Fred, in just a few minutes. So stay tuned, as they say locally.
All right, time for the news, traffic, and weather. Bottom of the hour. We'll be back with more with Dr. David Klein.
And that's a pretty darn good question, okay, all things considered. What is it, okay, that you can, what can you have? What kinds of disease states are going to make you more likely to be roadkill? So the first thing you can do, first thing you can control is your weight. You didn't get to be fat overnight, okay? And say, well, you're fat shaming. No, I'm not going to shame you, but I will try to motivate you. I mean, I don't really care what you look like. I mean, it's just the way that it goes. It's a matter of pride in my world. But as these things go, okay, you gain weight, you become less healthy. Not only does it tear your knees up, your feet up, your hips up, your back, your neck, and then make you have to buy, bigger clothes, but it also makes you greater risk for other illnesses of a chronic nature. So thyroid disease, hypothyroidism can lead to obesity. So you have to look for thyroid disease, and getting a TSH, thyroid stimulating hormone assay, is not even close to being enough. That's the way they typically do the screens, though. Well, when I go to the family doc, they always screen me. Yeah, they do a TSH and then they throw you out because they really don't know what to do if they did get the right data. So you need to be looking at the absolute levels of the hormones themselves. That's T3 and T4 levels. If you insist, you can get free levels. I do it because the family docs seem to think it's important. I'm not so sure that it does. But then most importantly is you look for autoimmune titers for thyroid disease, because 1/3 of the people with thyroid issues, it's autoimmune, which means you can have a normal TSH, a normal T3, and a normal T4, but have antibodies to the converting enzymes, the receptors, the carrying proteins. There are a lot of ways you can get sick with it and have perfectly normal levels. So look to your temperature. It will speak volumes. If you have a low temperature, well, the doctor tells me I have a low fever. What's a low fever? There's no such word. Either you're febrile, which is 101, or you're afebrile, which means it's below 101. A normal temperature runs from 97.6. That's at 0400. That's 4 o'clock in the morning for you non-military types. And it goes up to 99.6 at around 2200 hours. That's 10 p.m. for you non-military types. It goes up and down as the day goes on. So to interpret a temperature, you need to know the time of day. Okay, if your temperature's running low, you think thyroid, or you think cortisol deficiency, because not enough cortisol, thyroid doesn't work. Not enough testosterone in your system, thyroid doesn't work. And wouldn't you know, not enough progesterone, thyroid doesn't work. Interesting little ditty, okay, is that if you don't have enough estrogen, you don't get enough TSH, which means that really throws off the family docs. So yeah, that's kind of an interesting thing. So if you think you're perimenopausal, they're going to miss thyroid disease about half the time.
You got a great text that you have to answer.
Uh-oh.
Abscess near the anus.
Oh, well, it's the problem with the anal abscesses, okay, is they make the heart grow fonder, right? Abscess makes the heart grow fonder. Okay, so what's the text? Okay, so that's coming up on DBO. Oh, so it's not one of our Facebook types. All right, so we'll get that in just a second. They're talking about. I don't know. I can't hear.
Directly to your home or business right now.
Oh yes. Okay, that's pharmacy specialists. These are good people. Well, it's a family-owned business. Okay, yeah. So, but they're actually excellent. Okay, at what they do. These guys are artists, guys and gals. They're artists at making custom medications. So when I do my hormone replacement therapy, I send just about every patient to them. And if they ever go anyplace else, it's under my protest. And it's usually because what they get into a peeing match with one of the pharmacists. I want to go someplace else now. It happens.
Debbie from Cafe Park says, hey, Dr. Klein, thanks for all your information. And Ian says, I'm in Myrtle Beach. Really look forward to hearing you every Sunday. You're brilliant.
Well, thank you.
Hashtag
Okay.
I'm a fan.
Hot dogs. Well, Ian, thank you very much for that.
I don't know if this is on Facebook or if you're listening on the app. It'd be great to hear one way or the other.
Yeah, and we also have an app for your phone called Stages of Life Radio. And so if you go on your telephone, search for Stages of Life Radio, it'll pop up and it's 24/7 listening to me ramble. And they're 10 to 15 minute segments on this and on that. Very little interruption because guess what? It's all programmed weeks ahead. So there's no news, 3 things you need to bother you or whatever it happens to be. And but there's a lot to be learned on that, I would think. So, but thank you very much for the compliment.
Brought to you by
All right. Got to pay the lights.
I guess.
You know what's worse is television. Yeah, we were on Fox News this past week, for the COVID testing. We were the first doctor's office in the country that was able to do antibody testing. Oh, they have been. Yeah. It's awesome. So now there are a whole bunches of pictures of my hands holding a COVID test on the national Fox feed. So it's different. But yeah, so we're doing them in the office, and so we're going to be able to tell you whether or not you've mounted an immune system response to it. Whether you've been exposed is really what it tells you. And our response so far, what we've found is a 1.8% incidence here in Florida, Central Florida, which corresponds to what they're finding with the PCR testing. So it's fun stuff. I mean, if you're a geek like I am, it's fun. It probably makes everybody else bored to tears.
But I like it.
Yeah. So what else we got? We got anything else up there? Oh, and then somebody's going to be asking about quinine water. I am so happy. Okay, they're going to be asking about quinine water because this is a pet peeve of mine. So hang tight because we're going to talk about quinine. And here we go.
Here we go, guys.
News 96.5 WDBO.
A multimedia source all week this week. Hope you had a chance to catch him. But you can always catch Dr. Klein right here on News 96.5 WDBO every Sunday. He and I get together at 3 o'clock with you, and we have some great discussions. Now, before the break, Doctor, we were talking to Ken, or Fred rather, and we lost Fred during the break. But were you finished with this topic?
Yeah, pretty much. I think I got it. I think I covered it. Yeah, if I didn't, Fred will call back. So we'll deal with them.
You bet. All right, buddy. All right, we go to, let's see, it's Dennis in Orange City. Dennis, thanks for joining the show. You're on the air live with Dr. Klein. Go ahead.
Thank you guys for taking my call. And my question is on testosterone, Dr. Klein.
Sure.
I get 1 milliliter every 2 weeks. And the last time I had blood work done, it showed my testosterone level was at 125.
Okay. All right. Well, the 125
is there a safe level to take, a little bit more? Sorry. Go ahead.
All right. Well, Dennis, here's the real problem, okay, is that when you're getting intramuscular testosterone the way you're doing it, there's never a good dosage. Okay. It's probably the least favorable way to take testosterone. The reason I say that is your body needs to have a surge of testosterone every day. It begins around 3 in the morning and ends around 7, 8 o'clock in the morning. It pulses. Boom, 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 boom. That's the way it's supposed to run. When you do an intramuscular injection every 2 weeks, you're going to see a peak that's going to last 3 to 5 days, and that's going to taper off. And so then for the next 10 days, you've got nothing. So depending upon when they draw your blood, it's either going to be one of two things, too high or too low. The body doesn't like either. If they put pellets in, not only is that more expensive, but now you'll end up with levels that you can't control. Because once you put the pellets in, you're kind of stuck with them for 90 to 120 days. End of discussion. So, and then more so is that you don't get that same variability. It gives you a flat level. So when you breathe in, you breathe out. You breathe in, you breathe out. Your heart beats hard, 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 hard. Same thing is going to be true with testosterone. So I take testosterone every day, and I go transdermally with it. So my dosage is 50 milligrams every day. That's 350 milligrams a week. That's a whole lot more than you're taking, because you're probably taking 100 milligrams a week. But what happens is most of it doesn't make it through the skin. There's probably about a third of it makes it through, which is fine. That's what it takes to get there. But the dosage will get my level between 5 and 700. So your level is at 100, which is about 1/4 of what it should be. So you need to be looking at that. So the way you're doing it, Dennis, is just not any good. Okay, so what's a safe amount? If it's going intramuscularly, I would be convincing you to do it my way, which is to use the cream. What does the cream cost? And it's about $28 a month for my patients. So we get them prescriptions for 90 days for $80. It's very, very inexpensive. And I'll tell you what, it hurts a lot less than that 22 gauge needle that you're having somebody poke you in the thigh. So does that make sense, Dennis, or am I rambling?
No, that makes sense, but you said you're getting yours transdermally, if that's the right word. What does that mean?
It means it's a cream that I rub onto the inner aspect of my forearm, and I do it every morning after I shower. And it gets my levels exactly where they need to be. It's an uptown way of doing it.
Oh, okay,
it's a little bit more advanced than what you're doing. What you're doing is probably 30-year-old technology. So things have come a long way, Dennis.
I'm surprised that my doctor did not prescribe that for me.
My friend,
I'm glad I asked you that.
My friend, nothing surprises me. Nothing surprises me. So, Dennis, you have a good one. If you want me to talk you through it, or if you want to come on in, we'll be happy to fix you up with it, because it's really very simple. You do blood work, see what you need to do, get the medication on board, wait 90 days, recheck your levels, make sure you're where you need to be, adjust, wait 90 days and recheck. That's how we do it. I've been doing it the same way for 40 years. And, I like it. So,
good way to go, Dennis. Thank you so much for the call from Orange City. And right here is a regular caller on our show. It's one of my buddies from the Villages. That's Steve. And Steve, what's on your mind today?
How are you, Rob? And how are you, Doctor?
I'm well.
I know you always tell us to be careful where we get our medical advice from. That's why I listen to your show. And recently there's been a video circulating on the Internet from a young doctor warning people to insisting on taking high doses of zinc, usually 100 milligrams or more per day, with some quinine as a preventive for the coronavirus. And what are your thoughts?
Well, my thoughts go...
He's been everywhere.
Yeah, he's been everywhere. He's a chiropractor. Okay? The guy never did a day of medical school. He probably didn't take any chemistry. I can promise you he didn't take any real physiology, and he doesn't know what he's talking about. Okay, hydroquinone substituted for quinine maybe 30 years ago, because we used to use a lot of quinine. The drug that I was trained with is called Quinidex. We used to use it to treat certain types of cardiac dysrhythmias or arrhythmias. And so, but it went out of favor. You know why? Because it's cardiac toxic. Now, you put a little bit of quinine into tonic water. Why? Because that's the way it's been done since the British invaded India. Okay, that's just the way that it goes, and it makes it nice and tart. But you can't get enough quinine in tonic water, with or without gin, to make a difference. Okay, it doesn't make any difference whatsoever. So what do? So if you think you're going to fix coronavirus with that, you are sadly mistaken. Or if you really want to do it, you go out and get the hydroquinone. This stuff is $10 a month. It'll cost you a whole lot more just to keep yourself in gin and tonic. What about the zinc? Too much zinc will cost you your ability to taste and smell. So at least 100 milligrams. Nonsense. I never give people more than 50 milligrams a day. If it's in the right form, that does the job. And what do you think zinc is going to do for your immune system anyway? If you have a zinc deficiency, taking zinc makes sense. What zinc do you take? Zinc gluconate, zinc taurate, zinc malate, but it's going to have to be a chelated zinc. One of these organic esters. That makes sense. When you take zinc, if you take it by itself, it can cause thyroid issues. So you have to take it with selenium. So zinc and selenium are taken together. Too much selenium is toxic. So to tell somebody, just run out there and take at least 100 milligrams, God knows how many people are going to get into trouble with this. This is not a place where any sensible person is going to be taking medical advice. And by the way, if you're going to take medical advice, you stand a reasonable chance of getting good advice or adequate advice if it's a doctor. If it's a chiropractor, I'm terribly sorry, but this is a little bit of field of what he's trained to do. So quinine water, nonsense. I will drink quinine water with a good gin. Okay, that is something that is perfectly reasonable. Okay, but if I think for a minute it's going to help me with coronavirus, not so. The zinc, same thing. So what I do is I use a product that we've got called Magic Minerals because it has the zinc and selenium in the right dosages. So it makes it easy, makes it inexpensive. You know, you can do it any way you choose to, but be very, very careful from whom you take advice, location, and application of those sorts of things. So just because somebody managed to do 1 million views on YouTube doesn't necessarily mean that they're A, smart, or B, very adequate in their education. So Steve, I hope that answered your question. And you know, you just made my day asking it, because I've been going nuts answering this one patient at a time for the past 2 weeks. And it's craziness. So if you want hydroquinone, go out and get it. It's all over the place now. You know, there's no reason why you wouldn't. Zinc is something that I take every day and have for 25 years. So start on it, take it properly, but not 100 milligrams. That's just nonsense. It's irresponsible, actually. So Steve, thank you very, very much for calling. I'm sure there's at least one other person out there that's been confused by this. You know, probably about 100,000 people have been confused by it to be true. But in any event, so Robert, what else we got out there? Anything going on, or can I ramble
I'm going to give
again?
the phone number out: 844-220-0965. 844-220-0965. We're about 2 to 3 minutes away from the three big things. So you mentioned Down to Basics. You also have Magic Minerals. So
yes.
Tell us about that. They are available at your nutraceutical store.
Yeah, okay, so in any event, I try to make this easy for folks and affordable, make it inexpensive to be sure. But the big deal with regards to chronic illness is it's almost always a micronutrient deficiency. So the two most popular products that we have for this, one's called Magic Minerals, which is purely a chelated mineral product. It's the pieces and bits that you're missing in your food. And then Down to Basics, which contains a good healthy slug of the minerals, not to the same extent the Magic Minerals does, but it has all the other B complex, C, A, and the rest that are necessary in order for your immune system to work properly. And it's inexpensive. So the Down to Basics, you have to take 4 capsules a day. If you think you can get by with one, it doesn't work. You know, there's an old adage about how many pounds of potatoes can you get in a 1 pound bag. And then the minerals themselves, also 2 capsules twice a day. So the Down to Basics is, I think, $23 a month. The Magic Minerals is $22. You know, so you can really get a lot of bang for your buck with it. And I put these things together years ago, and I've pretty much let them. I haven't changed them actually in 15, 20 years. They're good products. So
if
and
they work, they work. All right, we're going to take a break right now for the 3 big things we need to know. You can call us right now. Get in line, 844-220-0965, 844-220-0965. So you could text us at 21232. The Stages of Life right here, featuring Dr. David Klein of the Stages of Life Institute. Check it out online. You're going to find so many sites, so many videos, so much information. You're going to be the king of the crop when you're walking around your town in about a month, and you're going to help tell people all about the information that you've gathered during this time off. All right, we take that break right now on News 96.5 WDBO.
Yay.
Okay, so in any event, so I've got a lot of information that you can check out. Okay, it's easy to get to, and it's inexpensive. Doesn't cost you anything. So it doesn't get any less expensive, and it's on stagesoflifevitamins.com. All right, great. Okay, then what you do is you pick a mineral or pick a vitamin or pick a product. Just go hit the search bar, pump it, just pump it in there. So for Magic, just Magic Minerals, MAG, hit the little magnifying glass, and it'll pop up. If you slide your way down the page, cursor down the page, scroll down the page, you're going to see a thing that says audio files. If you pick any one of the 30 or so different 15-minute lectures I've done, you can learn some things on it. So it'll talk about the use of minerals for diabetes, the use of minerals for thyroid disease, for rheumatoid arthritis, and it goes on and on and on. So there's something there for everybody. Or if you want to look up vitamin E, it'll talk to you about what that's all about. There's 6 different vitamin Ds that are, 6 different vitamin E's that are important to you. It's nice to know what you're doing, because when you go to buy the stuff, don't you think you ought to know what to look for? So fish oil, if you go to Heart and Soul, okay, why do I call it Heart and Soul? Because it's for your heart. That's from fish, S-O-L-E. And you look at the audio files. Pick a couple and listen through, and you're going to come away with it with an understanding as to why these things are important. That is what I've spent over $100,000 on all that stuff. It cost you nothing to use it, listen to it, and hopefully it'll be there for a long time. But the more you know, the stronger you're going to be. So knowledge is power. This knowledge is there. I've done and vetted all this stuff for you.
Okay, hold on. We got Tanya, who said her husband runs a low pulse oxygen, 95 and slightly under to like 93 when he sleeps. Anything you can do to raise those levels?
Yes. Okay. So we have somebody just called in, and her husband has low oxygen saturations. So with sleep, it's dropping the 93s. Awake, it's in the 95. So you've got somebody here that's got obstructive sleep apnea on top of what may well be either emphysema or chronic pulmonary disease of a different nature. Could be chronic bronchitis. Yeah, there's some things that you want to do to reduce the inflammation in the lungs. And one of the easiest things that I've found to do is to use turmeric compounds. So high doses of turmeric. It's not even really all that high, actually. It's between 500 and 600 milligrams 2 to 3 times a day. It's a tumor necrotic factor alpha antagonist. It's a type of anti-inflammatory, very, very helpful, very useful for lung disease. What else can you do? You thin the blood with fish oil. Okay, it's to decrease the viscosity of the blood. It passes into the alveoli, and you'll oxygenate a little bit better. And then the last piece I'd like you to try before we move on to something else is quercetin. Now, Quercetin, quercetin, or if you're British, it's quercetin, is interesting stuff. And what it is, it's a membrane stabilizer, and I use it for folks that have reactive airway disease, either due to allergies or due to other sorts of substances. The dosage there is 500 milligrams twice a day to start, then you go to 4 times a day and see how it happens. So I take the quercetin twice a day for my asthma. Works beautifully. I also take Singular at night. Helps me with my asthma. Okay, by this point, I'm sure your husband's already been tried on Singular. Okay, why? Because if you already know what the oxygen sats are and you're watching it, odds are you've already gone that route. So people out there thinking, well, what about Singular? You've already done it. Okay, but quercetin, wickedly cool stuff, anti-inflammatory and turmeric. And then the last piece of it is MSM, methylsulfonylmethane, also a marvelous antioxidant and anti-inflammatory, and works on these sorts of issues. So is it worth a try? Yes, and none of that stuff is expensive. Oh, we're good? Oh, okay. So,
Finish up and then I have another question.
all right, so we have another testosterone question coming up for Summerfield. I've got somebody with the question on arthritis, and we have one on Facebook. What do we got?
What about the scientists at Harvard putting out that the social distancing and stay-at-home order could be in place until 2022?
Okay. You got to be crazy. Okay, you want to, okay, like every other leftist state, let's stay at home and have the federal government pay our way. No, we're going to be back to work here in 2 weeks in Florida. Okay, now New York, it's going to take them a little bit longer. There's not going to be social distancing until 2022. We have had these sorts of pandemics before. They come and they go. If those geniuses at Harvard can give me one example, just one example of an epidemic that didn't go away, just one. Show me one that didn't come and go. Okay, that is the way these things work. That is the nature of an epidemic. It doesn't come and stay.
Hey, the Spanish flu, people got back out too early and there was resurgence.
Spanish flu, they didn't get back to it. There was no social distancing in 1917. They had something called the First World War. Okay, and guess what? Wouldn't you know it? At that time, they gave you a rifle, a helmet, and they shoved you into a trench. There were a lot of people that didn't make it home from that as a result of the flu. More people died of flu than of the war itself.
407-679-3337. You'll talk to Iris. Be nice. 407-679-3337. And don't forget, the Stages of Life is in Longwood. You can't miss it. Go to stagesoflifemedicalinstitute.com and you'll get all the information you need. Contact information, medicines from the nutraceutical store, and much, much more. All right, we've got 4 callers. We've only got 7 minutes, so let's use the time wisely, callers. First of all, we go to Mike right up here in Summerfield. And Mike, what is your question for Dr. Klein?
Good afternoon, gentlemen. I'll try to make it quick. I went on progesterone, the application, about 8 years ago, and they put me on with B vitamins and D vitamins.
All right.
And I know the absorption of D is so bad. Is there something I could add to this regimen to get more vitamin D? Because it seems like every year I'm increasing the vitamin D supplement. But is there something I could do to get more vitamin D without going to the beach?
If you don't want to go to the beach, okay, when you get ultraviolet light exposure, it increases your risk of cancer. Simple way to do this is you get vitamin D3, that's dog 3, and you take it concurrently with fish oil. Why? Because vitamin D is not a vitamin, it's a steroid. It dissolves in the oil and then absorbs better. So if you're not taking your D with an oil, it's not going to absorb. So the easiest thing in the world for you to do, Mike, is to take 2 fish oil with a vitamin D, and that'll get your levels where it needs to go. The typical starting dosage of vitamin D3 is 5,000 IUs. So you take enough, you take it with oil, and you too can have a good level, and don't stay out in the sun. It really is not good for you. Next caller there, Robert.
All right, Mike. Thank you so much, Mike in Summerfield. Let's go to Orange City, or Orange County, actually, and that's Sue. So, Sue, how can the doctor help you?
Yeah, so thank you for taking my call. I've been diagnosed with the RA for about a year, and I've been taking the methotrexate.
Methotrexate, sure.
And yeah, so which is 7 tablets.
So what's your question? Yeah, we got to get to it. We're running out of time. So what's your question, babe?
None of this medication helps my joints.
Yes.
Do you recommend any medication? Or
what else can we add to it? Okay, is probably what you're asking. So yeah, the first thing I would do would be to make sure that your vitamin D level is up, because it's going to help modulate your immune system, which is now a little bit out of whack. The second thing I would be doing would be taking a balanced mineral chelate, because when you have this type of autoimmune disorder, rheumatoid arthritis, odds are about 50% you also have autoimmune thyroid disease. So somebody has to get a look at you, make sure that the thyroid is not also involved. Third thing is MSM, oral MSM. Dosage there is 1 gram twice a day. It's a great anti-inflammatory, works particularly well for arthritis. And then Turmeric. Okay, the dosage on curcumin is 500 milligrams 2 to 4 times per day. It's a tumor necrotic factor alpha antagonist, very, very helpful for rheumatoid. And so that's where I would start with you. Then for topical use, the Kinkies that we put together works really well for rheumatoid. It gives you relief of a substantial amount in about 30 to 40 seconds. So yeah, methotrexate can be dangerous. Okay, it's something that you're very familiar with. But I would be taking the vitamin D with it. With methotrexate, you also have to take folic acid. If you don't take folic acid, you're going to get into trouble. So typically they give you one milligram of folic acid. I usually start with 5. So that would be the way I would change things around, Sue. So rheumatoid arthritis, there are things you can do. Rob?
Well, did that help you out, Sue? I guess it did. Okay, we're going on to Rolla. We've got 3 minutes left in the show. So, Rolla, where are you calling in from, and what's your question?
Hi, guys. I'm from DeLand. And hi, Dr. Klein. I'm one of your patients.
Yes, I know.
And just a quick testimonial. I have also been very confused about the hydrochloroquine and zinc.
Uh-huh.
And when you said magic minerals, I stood up and did a happy dance. I've been on magic minerals for like 3 years.
Yeah, and so
I'm like, yeah.
Yeah, well, it gets you what you need. You don't need to be worrying about taking more. Zinc is not an antiviral. What it does is it allows your immune system to work if you're zinc deficient. And the real trick here is to prevent disease, not to go running around and trying to treat it. So as far as the hydroquinone is concerned, hydroquinone is very, very useful if you start to get sick. It's of no value in terms of prevention, really. Okay, why? Because A, there's a finite supply of this stuff, and the last thing you want to do is to have everybody run out and buy it and then not have enough for the people that are sick in intensive care. That would be criminal. So no, I don't have any for myself or my family, and I don't prescribe it unless somebody comes in and I think they're either sick or they're getting sick. And then there'll be plenty to go around. Hydroquinone, the poor lady that we just talked to with rheumatoid, I'm sure they had her on Plaquenil. Okay, why? Because that's something that most everybody that has rheumatoid has taken at one time or another. So, but yeah, so the hydroquinone, if the question that you've got is should you be on it, the answer is no. If you start to get sick, and in this area, that the rural parts of Central Florida, the number of people that are sick with COVID is very, very small. So we are testing it in the office, and we're looking at 1.8% of the population that's asymptomatic, that may or may not have had an exposure, are positive for exposure. That's 1.8%.
1 minute, guys, 1 minute.
Very, very low. So, so in any event, I think you're going to do okay doing what you're doing.
All right, we're down to a minute, Doctor, and maybe we can get Bob and Poinciana taken care of. Bob, make it really fast.
All right, my 39-year-old daughter just was diagnosed with breast cancer, and
Sure.
she's going to begin chemo next week. What supplements should be taken?
Okay, jot this down. First thing, inositol, I-N-O-S-I-T-O-L. Inositol dosage there is 500 milligram capsules, 2 twice a day. Quercetin, 500 milligrams twice a day. Convince your doc to start her on metformin, 500 milligrams twice daily. That's a prescription. Good place to start with that. And the third or last piece of this would be berberine. That would be 500 milligrams twice daily. What these all do is they lower insulin, lower blood sugar, and actually improve survivability, not just with breast cancer, but all cancers. It's very, very interesting data. If there are doctors listening in, the way you find this is to go on National Library of Medicine, PubMed, PubMed.gov, do a Boolean search, use the nutraceutical, leave a space, put a plus, and then put breast cancer survival, and you'll be shocked at what pops up. Vitamin D, 5,000 IUs, you have to push in there.
All right, thank you very much, Dr. Klein. Thank you all the callers and everybody on the board back there. We had Chris, and then we picked up with Sam. So we've got everybody working hard for the Ask the Expert series, and we'll head to
Thanks, Doc.
My pleasure. You guys have a good one. And looking forward to getting back over that way, which I expect will probably be in 2 weeks.
Hopefully.
Talk to you later. Bye-bye.
Okay, I got one more question for Facebook.
All right, what you got?
A follow-up. Tanya said, can you take quercetin with blood pressure pills? She said she heard they contradicted with verapamil.
With verapamil? No, actually, I use it. I use it just routinely. Okay, it's not a big problem. Quercetin is as benign as it gets with regards to medication. Quercetin, marvelous stuff for allergy, marvelous stuff for reactive airway disease and asthma. And I take it on a daily basis. I highly recommend it.
All right. You want to say goodbye to everybody? We'll see you this week for...
We're on Connections this week? Yeah. Oh, you almost forgot the name of your show. No. Thank you guys very much for tuning in. It's always a pleasure to do this. And if you have any questions, I'll be on with Connections this Thursday evening. So you guys have a good one.